The appropriation of Lagos State for the health sector in 2016 was put at 64 billion naira, about 7.9% of the total budget. However, this was reduced to 57.2 billion naira, representing 7.5% in 2017. The reduction has attracted the interest of civil society groups, considering the population of the state estimated at 24 million people.
You see a situation where the Health Services Commission, the budget for the Health Services Commission was timely released, and about 70% of the budget line for that ministry, for that department was released. The Ministry of Health has a budget that was allocated but was not timely released. Where you now also have the Primary Healthcare Board not released. It's worrisome.
The drop was so huge, and many of us in the civil society, citizens have commented extensively about that, because with that figure, we're talking that every allocation is actually being budgeted 2 naira 70 kobo per capita budget on health, which is ridiculous, which is about less than 4 cents. So we really need to up our game. In Nigeria and Lagos State, I mean, even federal level, it's a similar current. And we understand that this period, Nigeria went through a recession, but we need to look at innovative ways of being able to raise the allocation in the health sector, which is one of the prime indicators of a healthy society.
The concern, voiced by Media Roundtable, observed that out of the 3 components of Lagos State healthcare delivery, namely Health Service Commission, Primary Healthcare, and Ministry of Health, the primary healthcare is the worst hit with parity of funds. The gathering also frowned at the frequent changes in the leadership of the Board of Primary Healthcare. Participants suggested the establishment of a local government health authority as one of the ways of addressing the challenges faced by caregivers.
There have been consistent movements of PS, of the permanent secretary in charge of the board, and this has not helped the system, the primary healthcare board system, to actually supervise the implementation of all the Lagos State policy on free health care for women, for children, and all that. And we know that the primary healthcare board is in charge of the PACs and other community health projects.
Primary health care covers all things of maternal health, child health. And those are the main issues that really need stringent attention. So it's an imperative for local government health authorities to be inaugurated. It's really as soon as the new chairmen are elected. That should be one of the priorities of the government, to inaugurate that, because without that there's a gap.
The roundtable also recommended continuous engagement of the civil society groups by the state government to improve access to basic health care need by the people, while timely release of at least 70% of capital budgets will go a long way in improving the health sector in 2018. Kikelo Mojiebo, LTV News.